Hi, good day. I'm Dr. Chan from Isaac. I'll be presenting on superior corneal incision, a perfect wound. For the purpose of illustration, I will render the video into slow motion to show what is actually done. I have no financial interest to disclose. This is a 2.75 mm blade which I use for both the side part and the main incision. Just as you enter the blade into the cornea, and you see a perfect triangle, withdraw the blade. As such, the main incision is made with the same blade with a biplanar wound. The initial entry of the blade into the cornea is almost parallel to the corneal curvature. Again, once the little triangle is seen, turn the blade so that the blade is parallel to the lens and make a full entry. A small triangular pouch is made just superior to the main wound, as such. After you have completed your cataract surgery, stromal hydration is not done, but instead, hydration is done to the pouch that was made previously. This step would reduce the amount of edema on the cornea and also gives a better wound seal to the wound that was done. Hence, the perfect corneal wound. This is a similar case that is done in real time. I have done an audit on my results and it has shown that there is no increase or reduce in the surgical induced astigmatism or SIA. Even if you have forgotten to do the initial pouch, you can actually do the pouch after the cataract surgery. However, the incision that is made may be more difficult to do as there is already edema on the cornea. The next case shows another standard cataract surgery. I have made a superior corneal incision as well, but the problem is at the end of the cataract surgery, I was unable to find the pouch that was supposed to be there. So I made another superior incision and do a stromal hydration on this new pouch, and it works very well as well. The next case is a complicated cataract surgery. It's a young man of 29 of age with intumescent cataract and is very mature. The lens pressure is very high and I have decided to do a decompression using a straight needle, and I have made sure that I've decompressed a lot of place and start to do a CCC. Unfortunately, this patient still have Argentinian flag, and long story short, I just proceeded with CCC and do a gentle phacoemulsification and completed the whole cataract surgery. This patient does have high astigmatism and I have decided to put in a toric lens pre-operatively, so I proceeded with the toric lens. Then I noted the second series of unfortunate event that the haptic of the IOL actually broke. I had to extend my wound and remove the IOL and put in a new backup IOL that has the same power. And this time it actually works quite well. Next step is to turn the IOL into about 90-degree position. There is a digital marker that is be able to see by the surgeon himself. However, it's not shown here. This is the final position of the lens it's supposed to be, and it's in good position. I have decided to use a Simco to remove the remaining viscoelastic, and finally to just close the wound with the superior corneal incision that was made beforehand. So even though I have enlarged the wound to more than 2.75 mm, I did not need to suture my wound and there was no leakage. Imagine a normal incision done. The main wound would look like such. There will be a slit on the main wound as such. After the phacoemulsification is done, the main wound may have been stretched by the phaco probe. A small gap may have been created in the middle, causing leakage in the gap that was made. In a normal stromal hydration that is done, usually it's both sides and the main wound. However, the center gap still remains, causing persistent leakage. In a superior pocket wound, a partial incision is made just above the main incision. Similarly, after a phacoemulsification is done, the gap is created in the middle caused by stretching. If the superior pocket wound is hydrated instead, this would actually reduce the gap that is in the main incision. This will seal off the wound completely and hence a perfect corneal incision. Hope this benefit everyone. Thank you very much for your attention.